Diabetes sends out 15 silent signs at night that everyone should be aware of. Sleep is not just for rest, it reflects your overall health. Unusual nighttime symptoms are your body's way of revealing its hidden secrets. Diabetes does not announce itself loudly. Those nighttime symptoms are the first ripples signaling trouble before the flow turns into a raging flood. This will cover the 15 subtle signs that show up each night, warning that something might be off with diabetes as the likely culprit. Watch until the end to recognize all the symptoms and get practical advice to completely transform how you manage diabetes. Number 1. Night sweats. When you fall asleep, your body is supposed to be in a state of relaxation and regulation. If you wake up in the middle of the night drenched in sweat, it could reflect that your blood sugar levels are dropping too low. Adrenaline is released to elevate blood sugar. This increases your heart rate and activates sweat glands. Nerves controlling sweat glands can also become damaged. If you often experience night sweats, check your blood sugar levels before bedtime. Stable levels in the evening should range from 90 to 130 milligrams (dl). Add a light snack before bed featuring low glycemic foods, for instance, whole grain bread with peanut butter. Keep room temperatures between 64 to 70 F or 18 to 21 C. Consult a healthcare professional if this condition persists. Number 2. Leg cramps. Sudden, painful spasms often stem from an electrolyte imbalance, specifically a deficiency in potassium, magnesium, or calcium. Diabetes can disrupt these elements. Peripheral neuropathy can cause damaged nerves to send incorrect signals, triggering cramps. Poor blood circulation also contributes. Include potassium-rich foods like bananas, sweet potatoes, or avocados. Boost magnesium intake through leafy greens, nuts, or whole grains. Perform calf stretching before bedtime. If cramps occur frequently, check blood sugar levels and consult a doctor. Number 3. Restless leg syndrome. This involves an irresistible urge to move your legs often at night. Peripheral neuropathy can produce sensations like tingling, prickling, or uncontrollable restlessness. It disrupts sleep quality. It is also associated with an imbalance of dopamine. Engage in light exercises like walking or stretching before bedtime. Increase iron and magnesium intake through leafy greens, cashews, and oats. Avoid stimulants like caffeine or nicotine in the evening. Number 4. Sleep apnea. This is a condition where airflow to the lungs is temporarily blocked. Lack of oxygen forces the brain to send emergency signals to wake you up. This increases the risk of blood sugar imbalances and insulin resistance. It strains the cardiovascular system. Monitor symptoms like loud snoring, sudden awakenings, or choking. Lose weight if overweight. Avoid alcohol or sedatives in the evening. Number 5. Frequent nighttime urination. When blood sugar levels rise, the kidneys work overtime to filter and eliminate excess glucose through urine. This causes frequent urination at night. It may be linked to kidney dysfunction. This disrupts sleep and affects blood sugar management. Control water intake in the evening. Drink more during the day and limit intake 2 to 3 hours before bed. Avoid caffeine and alcohol. Consult a doctor if symptoms persist. Number 6. Excessive thirst. Constant thirst at night is an early sign of high blood sugar. Frequent urination causes the body to lose water quickly, triggering constant thirst. It can lead to electrolyte imbalances and dehydration. Drink water regularly throughout the day and spread intake evenly. If thirst appears with dry mouth, frequent urination, or fatigue, consult a doctor. Number 7. Pain or numbness in the legs. Tingling, burning, or loss of feeling can be a sign of peripheral neuropathy. High blood sugar damages nerves. Symptoms typically occur at night. Loss of feeling increases the risk of injury without realizing it. Stay active with walking or yoga. Take care of your feet and wear well-fitting soft shoes. Number 8. Nighttime hypoglycemia. This occurs when blood sugar levels drop too low while asleep. The body releases adrenaline, leading to sweating, rapid heartbeat, trembling, or sudden panic. Severe cases can lead to seizures or coma. Monitor and record your blood sugar before bed. Safe range is 90 to 130 milligrams (dl). If lower, add a light snack with protein or complex carbohydrates. Adjust insulin dose or medication under guidance. Use a continuous glucose monitor to detect low levels. Number 9. Insomnia. Blood sugar instability can release stress hormones like adrenaline, making you alert. Insomnia is linked to insulin resistance. Maintain a regular sleep schedule. Manage blood sugar before bedtime. A light snack with complex carbohydrates can help. Avoid electronic devices an hour before bed. Consider sleep function tests if needed. Number 10. Acid reflux. This occurs when stomach acid flows back into the esophagus. Autonomic neuropathy can reduce stomach contraction and emptying. This increases pressure and leads to reflux. It affects absorption of sugar and medications. Avoid fatty, spicy foods, chocolate, caffeine, and alcohol in the evening. Eat lighter meals. Elevate the head of your bed by 15 to 20 centimeters. Maintain a healthy weight. Use proton pump inhibitors if needed. Number 11. Nightmares or vivid dreams. When blood sugar drops too low or rises too high, the brain gets overstimulated and triggers stress. This leads to dramatic dreams. It may be linked to sleep apnea. Establish a relaxing bedtime routine. Limit stimulants like caffeine or alcohol. Consult a doctor if severe. Number 12. High blood pressure in the middle of the night. Blood pressure normally drops while sleeping. If it remains high, it indicates an imbalance. This can be linked to autonomic nervous system damage. Stress hormones like adrenaline can increase blood pressure. Monitor blood pressure at night. Reduce salt intake. Avoid processed foods and caffeine before bed. Number 13. Palpitations. Fast or irregular heartbeat at night can be linked to abnormal blood sugar levels or electrolyte imbalance. It may reflect blood pressure or cardiovascular issues. Check blood sugar before bed. Add a light snack if needed. Increase magnesium and potassium intake through bananas, almonds, or leafy greens. Number 14. Teeth grinding. This often occurs at night and can cause jaw pain or headaches. Blood sugar imbalance can trigger adrenaline release, which causes muscle tension. It may also reflect autonomic neuropathy. Establish a relaxation routine before bed. Deep breathing, meditation, or warm compress around the jaw can help. Using a night guard protects teeth. Number 15. Morning headaches. When blood sugar drops too low, the brain lacks energy, causing headaches. It may be linked to sleep apnea or dehydration. Create an ideal sleeping environment. Keep the bedroom cool and quiet. Avoid alcohol or sedatives. Drink enough water during the day. Include foods rich in potassium and magnesium like bananas or leafy greens.